So nowadays, cold and cough are most common respiratory diseases. Okay, because of the environment, because of the polluted air, because of the polluted food or contaminated food, or else any other things, bacteria, infection, viral infection, influenza, etc., etc. So basically, in 10 out of 9 people will suffer from cold and cough, maybe monthly once or monthly twice or 2 to 3 months, in 2 to 3 months, once or twice. So basically, after COVID, the occurrence of cold and cough or common cold and cough is common in the children. Okay. So basically, mostly the newborn children or else infant, okay, or children about 2 to 3 years, they have continued cough and cold nowadays, very common. So basically, why this is happening? Because of the immunity, lack of immunity in the lungs, which leads to cause of cold and cough. Even though the children are taking virus in immunization, immunization they are taking daily regular, according to their chart, they are taking different types of immunization. Okay, even though they are suffering. Okay, why this happening? Because of the lack of immunity, natural immunity. Okay, natural immunity power is decreased nowadays in the children or in the young men and women, in adults. Okay, so what we have to do? We have to increase our immunity first thing, and to improve our immunity, we need time. Okay, immunity will not develop in days or months. Even sometimes it will take a year also, year to years, 1 to 2 years, because of the whole functioning of the body is depend upon the immune system. Means immune system will develop only after whole body develops. So that's the reason it will take time. Okay, so in my opinion, immune system, due to the lack of immunity, is the reason of cold and cough, thereafter other issues of the lung respiratory distress. Okay, so now today we will talk about cough. Cough is a symptom. Okay, cough is a symptom of respiratory system. Okay, and second, it is the reflex. We have the respiratory system here in our cerebrum. Okay, in cerebellum, sorry, or pons, medulla oblongata. We have respiratory system. So cough, it will, whenever an irritant enters into our respiratory system or upper respiratory tract, what our body do, he will do reflex thing to remove the irritant from the lungs. So cold, cough, what happened? Large amount of mucus is accumulated in the lungs in wet cough. Okay, a large amount of mucus is present in our nose, nostrils, and here in the sinus area. So what happened? The brain want to remove the irritant from the part of the respiratory system. So this is the mechanism. This is the thing how cough occurs. Okay. Here also given that respiratory irritants. Here the name is given respiratory irritants. Okay. So what is acute cough? Acute cough means it is below 21 days. Okay. If it after 3 to 8 weeks, it becomes subacute cough. After 8 weeks, it become chronic cough. Chronic cough may be due to the pulmonary issues, means lungs issues, and secondary cardiac issues. Okay. And the most common thing which is seen in the smokers, that is bronchitis. So you have bronchi which become inflamed due to the inhaling of smoking, inhaling of cigarettes or BDs, tobacco, etc., etc. So in the acute cough or subacute cough, chronic cough, we need examination. We can understood that this is the problem of respiratory system, because there is an irritant which is irritating the lungs. So the body producing the reflex, that is in the name of cough. So we have to check the lungs first primarily, and secondary cardiac issues, because there is, if any issue in the cardiac problem also, we have issue in the lungs. Okay. This is also most common issues. Other than that, we have asthma or gastrointestinal or gastroesophageal reflux disease. Okay. And and some medications which will cause cough also. So that is ACE inhibitor. Mostly it is used for the hypertension. Okay. So what we have to go? We have to go with the uh, chest X-ray. Okay. Chest X-ray, which can give the clarification what type of problem occurs in the lungs. Basically, it will start with cough, cold, and it will become bronchitis. And if you're not treated, it will become pneumonia. After that, it may be become the infection which will present from longer duration. It will become tuberculosis. And after that also, if you're not treated, it will become leprosy, or the patient will die due to the respiratory issues. So here we have to approach the lung diseases with the chest X-ray. So we need chest X-ray. If the acute cough is not subsiding or not decreasing, not patient have relief, so we have to go with the chest X-ray. If the chest X-ray is normal, then we will, what we have to do? Let's see. So basically, patient will come to your clinic with a complete of, and I am taking here cold also, because cold and cough, though both are, sometimes the patient will have both. Sometimes the patient will have only cough. Some patient will have only cold. Okay. So nowadays, from past 3 to 4 months, number of patients are coming with the complaint of cough. They are taking antibiotic. They are taking uh, all the types of anti-allergic drugs. They are taking other medications which will suppress the cough. Okay. But even though the patient did not getting, and the patient will not have relief. Okay. So why this is happening? It may take it may be presence of any other virus which is causing, or else it is due to the pollution. Okay. It may be, we have to uh, do the investigation for that. Okay. So clinical assessment. One patient come to your clinic with the cough and cold. How do you approach? Okay. First, you have to ask the patient that you have runny nose, okay? You have sneezing, okay? These are the symptoms of cold, or rhinorrhea means rhinorrhea means it is a runny nose only. So it mostly it is related to the nasopharyngeal problem. So here only there is an issue. Okay. If they have only a sore throat, burning in the throat, it means not only nasopharyngeal affected, oropharyngeal also affected. Okay, this is the second thing. And the third thing, if there is a problem in the trachea or from the lungs, he is coughing like that, there is a sound of in the lungs, from the lungs, all the respiratory muscles also involving while coughing. So it means there is a issue in the lungs. And along with that, if the patient have burning sensation, it may be due to the gastroesophageal reflux disease. Okay, you can correlate with that. There is a problem in the esophagus. Gastro means it is the esophagus or stomach issues. Okay, you can go like that. If the patient is taking any medications, you have to ask the side effect of the medicine may be also cause cough from the longer treatment. So you have to check that. And the second is if the problem is from coming from the heart, okay, we have to see the lung sounds. I have to check the lung sounds with the stethoscope. Okay, so we will do the physical examination of the lungs in the pulmonary diseases. Okay, then we will understand. So we have to check the lung sounds. We have this is the lungs. So we have three lobes in right lung and two lobes in left lung. So we have heart here. So we have to check the sounds in the upper lobe. First, we have to put the stethoscope here. Okay, then we have to put the stethoscope here, second lobe and third lobe. Here we have to put the stethoscope here and here. So we'll get the sound of the lungs. Like some, we have the leaf and we have the air, wind. So wind is touching the leaf and going. So how the sound occurs, like the sound we'll hear in the uh, stethoscope, with the help of stethoscope, you can hear that sound. So this means this is the normal lungs. There is no issue in the lungs. If the problem is in the lungs, if there is a problem in the lungs, how the lungs, it is like sneezing sounds, something like that, or else like rubbing sound. Okay, and this is the first examination you have to do. And second examination, if there is pneumonia or any other diseases of lung, you have to do the clubbing. You have to put your finger and you have to club like that. So if any fluid is present, you will get to know that uh, like something waves coming, water waves. Okay, this is the second type of physical examination you can do. And you have to check the nasal cavity, you have to check the oral cavity with the torch light, and you have to check the ears also. Okay, these are to very important because we don't know where the problem is there. Okay, the patient only coming from the cold and cough, but we have to check. We have to check the nasal cavity with the torchlight and the oral cavity with the torchlight, and you have to check the ears both, and you have to put your thumb here and check the we have the tonsils here. Is any issues in the tonsils? And you have to put like that and ask the patient, is there any pain? And check with the stethoscope and doing the clubbing things, which will help you to check the issues. So if the problem is in the nasal cavity, you need to, the patient have the acute symptoms. So it is the initial way to enter the infection or any type of disturbance to the lungs. So you can stop here only. Any issues in the oral cavity, you have to treat like that. If any issues in the tonsils, you can treat like that. Okay. First, we can do the chest X-ray. And the other test, like if the patient have chronic and very uh, from past longer duration, you can go to the sputum test, blood test, okay, and culture test of the sputum, and along with blood culture, we can do with that, and CRP, CBP, ESR. These are the things you can check that the patient will have any type of inflammation. Okay. And you can do spirometry, which will give how much amount of oxygen is inhaling the lungs and how much amount of carbon dioxide is taking by the lungs. You can see that, or pulmonary test. So these are the tests you can see. Okay. So this is the thing you can do. So first we have to check from how many weeks the problem is there and what is the reason, mostly the viral, the fungal or bacterial, or else gas pulmonary issues or cardiac issues, or rest here we have the gastrointestinal issues, or though other than that we have drugs which can cause cough, and we have to check the symptoms like that, sneezing, running nose, or burning in the throat. Okay. And sometimes in serious condition, the patient will have uh, shortness of breath due to the effect in the lungs. Okay. And examination very important, nasal examination, oral examination, ear examination, and checking the sounds of the lungs and checking the clubbing of the cupping. This is very important, and we can do spirometry and advise chest x-ray, or if there is lot of sputum is coming, can check the sputum test. Okay. So this is the thing we can do that. So now discuss the treatment part. Okay. Now we'll discuss treatment part, cold and cough. If any doubts, till now you can ask, or else we will talk about the treatment part.
No
So
doubt, sir.
actually, doctors will write RX. RX is a symbol of treatment. But we are electrohomeopathy doctors, so we have to differentiate from that. So I advise to write RM. Okay, RM means remedies. You can go to the line like that. Okay, if anyone want to write. So actually, the allopathy doctors will write RX. So we are electrohomeopathy, write RM also. Okay, so here basically in the cold and cough, mostly they have 80% will have acute and subacute conditions only. So it means that you have to select D5 or D6, both dilution. Okay, you can need. But nowadays, due to the serious effect of cold and cough, in nowadays, we can also advise D4 to the patient because of the severity. Okay, it is acute, but it is reaching to the chronic stage in early days only. So there is the reason we are advising D4 also some patients. So first 3 days we can give D6. After 3 days D5. Then we have to after 1 week or 10 days or 15 days we can give D4. So basically we treat cough and cold for 1 week, 10 days mostly. Then it will okay to the patient. But from past 3 to 4 months, I am giving the remedies for 2 months, not for 1 week or 10 days. If you have cold and cough, you have to take 2 months remedy. Okay, so it is like any chronic diseases, like it become a chronic diseases. Okay, so initially only if you take 15 days, it will be reoccur. Okay, so you have to take 2 months remedy. So we will start with D6, then D5 and D4. Okay, or else D5, D6, and last one D4 if the severity is more. So what are the remedies? So basically, it is dependent upon the severity. I already told you that. Basically, what are the things are there in the respiratory system? Let's talk about. We have mucus, very important, because for the lubricant, because the easily passage of oxygen into the lungs, we need mucus, and we have to stop the bacteria which will which will do purification process also. Mucus very important. And we have arteries, veins, okay, blood vessels classed. These are the present in from nasal cavity to lungs. We have epithelial tissue, which is the covering of lungs or respiratory system. Epithelial tissue, we have mucus, and we have the arteries, veins, and we have nerves, nervous system, and we have the nose. What are the organs we have? Pharynx, larynx, and we have here we have the tonsils. Okay, we have trachea, and we have lungs. Okay, we have lungs. Next, we have uh, esophagus, and lastly, heart. So, how we will reach? So, we need this type of remedies to our body. So, we have P1 for upper respiratory system, P2 for upper and lower both respiratory system, and we have C13 for throat, and we have S5 or S3 for mucous membrane of epithelial tissue, and we have P3 for children's and women's, and P4 for chronic. Okay, so these are the remedies, and along with what you have, because the respiratory system is connected to the brain, so we need brain remedy also, F1. Okay, so to metabolize this remedies, so sometimes we need S10 also. Okay, so these are the remedies mostly we use for cold and cough or respiratory issues. Okay, if the bacteria is present, fungal infection is present, you have to add Ver1 also, or sometime Ven1. Okay, likewise, we have to add the remedies. So basically, we can start with basic, mild, again, moderate, and severe. The dilution will change according to the stage of the disease, acute, chronic, and subacute. Moderate and severe. So mild, in mild cases, we have P1, C13. And forget to tell you about the electricities. So mostly electricity are used BE and GE for the respiratory system issues. So here P1C13B start with D6 or D5 here. Okay. And we can give P2 again C13B, because we don't know there is a problem in the upper respiratory system, lower respiratory. So both we are adding. Along with, you have the respiratory centers. We have the points, 45 points. In that, we have the point number, uh, the point which will describe the lungs points. Okay, you have to put the lungs point here and here. Okay, so you can apply P2 or P2B, okay, P2B or P4B if condition is severe. Okay, so this is the case of mild. In moderate cases, you can take P1, C13, F1B, okay, and P2, C13, GE. Here we are taking G. And if the infection is mostly infection is there, so we will go through P1, VER1, and Y. Okay, so we have to reduce the, and we have to application again, P4, B, and C13 also here, or S5, S5, P4, C13, BE. You can choose with a stage of the disease. Okay, mostly D5. In the most of the severe cough, okay, P1, S10, F1, BE. Here we are going with S10 and F1 also, because to improve the this medicine metabolism also, and the in the body metabolism also, and F1 due to the respiratory centers. And we are taking P1 plus P3 here. Again P4, C13, BE. You have to take all the remedies in severe condition. P3, C13, P2, C13, BE. Okay, if the infection is also there, you have can add VER1, sorry, C1, VER1, Y, if any issues, or C17. Here you can add C17. And we have for application F2, you have to check. You have to apply here F2, P1, BE, or P4, B. So these are the remedies you can advise the patient in the mild, moderate, and severe condition. So you have to check the problem. It is due to the bacteria. You have to add VER1 also here, or in the not bacteria, not other things. It is due to the gastrointestinal effect also. You have to check the asking the patient that any issues in the gastric region or burning sensation, digestion, etc., etc. You have to ask. So likewise, we are treating the cold and cough. Not only treating the cold and cough, and we are giving strength to the patient after relieving. After relieving, please remember you have to give P2C13BE for 1 month. First 15 days D5, then after 15 days D4. This is the remedy. Again, whenever the climate changes, you have to tell the patient your lungs are very weak. You have to improve your immunity. You have to not to pollute, but you have not to inhale polluted air. You have to need fresh air. So you have to always, before changing the climate, you have to take this remedy for 15 days or more than 15 days. Okay. So likewise, or else you can continue for 3 months also, P2C13BE continuously. First 1 month D5, second 5, D4, D5, D4, D4. Okay. So this is all about in today's class. If anyone have any doubts, kindly ask.